So you talk about prophylactics in abortives, right?
Mhm.
And a lot of people don't know specifically what those are, right? Some people are just said, here, take this. So can you give us a little bit of context for people, to have the preventative versus abortives and what good
Okay,
times
great.
for taking all of that is?
Sure. No, a really important point, right? So the paradigm for care for cyclic vomiting syndrome, obviously, no one wants to have to suffer through these attacks. But the clinical approach really is anchored by how frequently one is experiencing an attack and how long those attacks tend to be. You know, this is a very heterogeneous disorder. People have all sorts of different experiences with, and still all have cyclic vomiting syndrome. So everyone should have access to an abortive care kit, essentially medications that are designed to use at the soonest possible recognition that an attack is happening to try to actually preempt the attack from progressing to a full-blown episode. So that's kind of a baseline of care. And there are various medications that can be used in that context, anything from antiemetics like Zofran or ondansetron, Imitrex, or sumatriptan, a medication that can be taken actually for migraine, but also for cyclic vomiting syndrome, and a variety of other medications can be used. So everyone should have access to abortive medications, but then not everyone really requires prophylactic medications. This is reserved for individuals that have much more frequent attacks, longer attacks, or landing in the hospital frequently in a year. And those are medications taken every day to try to mitigate the likelihood of an attack, or at least space out the frequency of attacks. So those are two different tracks of treating cyclic vomiting syndrome. So I would say those with more mild forms of illness, where they might have 3 attacks in a year that last for a day, maybe land them at home, but they kind of bounce back. Having access to abortive therapies that they can use to try to preempt it, that would be a perfectly good approach. Whereas someone that might have 5-day long attacks, 8 a year, 4 of which land them in the ER or in the hospital, they probably need a prophylactic therapy. So hopefully that clarifies that. There's a lot of nuances in between, but I think those are two kind of extreme examples.